Good afternoon. I'm here with Mayor Turner, with Dr. Mark Boom of the Methodist Hospital System, and also here on behalf of the group of CEOs that lead the Texas Medical Center hospitals. Dr. Paul Klopman is here as well, CEO of Baylor College of Medicine, and Dr. Shaw, Dr. Purse, with the Harris County and with the City Health Departments respectively, are here to answer questions alongside Dr. Porsa, who is the CEO of the Harris Health System. As a brief update, we had over 50,000 hits to the dashboard we unveiled yesterday, and I'm glad folks are taking advantage of that resource. You'll continue to see a daily update of our case counts, and we'll be able to keep track of that there. We received a new supply from the federal government this morning to be able to continue our testing sites. And so far, we've done over 4,000 tests at the county sites. The city, of course, has been running their site at maximum capacity, and we know we will have enough supplies for at least the next few days while we receive the next shipment. So that's some good news. Overall, our county has been coming together by staying apart. We're a model so far for other communities around the state, around the nation, because we're working to stay ahead of COVID-19. And success is not guaranteed, but we're giving ourselves the best shot because each of us are playing a role in this, and each of us are making the sacrifices necessary to stay ahead of this virus. For this thing to work, it takes buy-in from everybody at home. And years from now, we will be talking to our kids and our grandkids about how we survived the coronavirus crisis, how we doubled down and made incredibly difficult choices and sacrificed on behalf of our community. We'll be able to tell the story then. We'll be able to talk about the hard times, the hard economic times, how difficult it was to be home, how difficult it was to homeschool children and to make sure we could provide for our families. And right now, we're at the moment of making those difficult decisions so that later we have a positive story to tell about a positive outcome, or at least the best outcome we could have possibly worked toward. And we'll remember how we acted boldly, how we made tough decisions, how we came back together stronger like we always do in the face of adversity. And that's what we're doing today. The medical center CEOs unanimously advise that we extend our stay home, work safe order. The increase in cases we've been seeing into our hospitals, they very much track concerning trends. It is not the time right now to scale back in our containment measures. If anything, it's the time to double down because our rates continue to grow very, very rapidly, and we've not yet gotten to a point of flattening the curve. If we can help it, we're going to avoid being where other cities and counties are. We're going to do everything we can to do better. But our roadmap back to normalcy begins with the extension of our stay home, work safe order. And so today, I'm extending the order throughout Harris County, which includes unincorporated areas and all the cities within Harris County, through 11:59 p.m. on April 30th. We'll revisit as time goes by. If the situation changes for the better, of course we will adjust. We want this to end sooner, but we're making decisions based on the data and on the healthcare advice. We've stayed ahead of COVID by respecting the advice from doctors, from experts, and we'll continue to do that. We will continue to act swiftly to try and flatten the curve. And so we will have the updated order online, and we're continuing to update our frequently asked questions page on readyharris.org, where we are updating according to the questions we've gotten from the community in terms of what exactly the order means. I want to remind folks that the order is about erring on the side of staying home. And so we continue to ask everyone to make that decision if you're on the fence about whether you're essential or not. Ask us. We're issuing waivers. We're relevant. But for the most part, our assessment is we need folks to stay away from one another in order to do better with this crisis. We are aware that the governor just issued an order statewide, and so we're very glad that he's doing that on behalf of all Texans. I'm, of course, always supportive, and to the extent that his order conflicts with our order, we'll work that out in the future. At this point, let me welcome Mayor Turner to speak. Then Dr. Boom and Klotman will speak, and I will conclude my remarks and then repeat everything in Spanish and finally open it up for questions. So, Mayor Turner, thank you so much for your leadership.
Thank you, Judge, and certainly appreciate your leadership, and always enjoy working with you and visiting with you, and I look forward to the time when we can be talking about something other than the coronavirus. Let me just say that from the outset that we're standing together in complete agreement on the extension of the Stay Home, Work Safe order, which is critically important, and it's important that we kind of align as much as possible. And I know the President has extended the social distancing order till April the 30th, and the governor's now put forth his order that goes to April the 30th, and now Harris County, which Houston is certainly part, is extending this order now until April 30th as well. And the singular goal is worth repeating again, and that is to blunt the progression of this virus such that it does not overwhelm our health care delivery system. That's the goal. And if we continue to work in concert with one another, I believe that is a very achievable goal. Just this morning, for example, had a conference call with many of our elected officials on the federal and state level. And on that conference call, we had Dr. Peter Hotez from Baylor College of Medicine. And the question came up, when do we anticipate this virus peaking in the state of Texas? And the time period that he gave us this morning was that he anticipated the peak to occur sometime right around May the 2nd. But that's assuming that we continue to be aggressive, that we can continue to work together in practicing social distancing, and minimizing our interaction with one another. So that's the goal. That's just one of the reasons why this order has been extended until April 30th, because we just can't assume that it's going to happen without all of us working together. Let me also say that we have already been doing the testing at the Butler Stadium. We are increasing the number of people that are coming to that site. It can go up to about 250 at that site, and more people are coming out. Tomorrow, we're going to be standing up the second site at Del Mar Stadium as well. So both sites, we will be doubling our capacity in the city of Houston for testing as of tomorrow. And we are hoping to increase the number of people that can be tested at these sites. Right now, the maximum number is 250 per testing site, but as of about 2 o'clock, 2:30 today, we had already, I've been told, reached that maximum testing capacity, and so hopefully we can increase that, because it's through testing that we'll get a better sense, a better feel as to the degree of community spread. I certainly want to appreciate our federal partners for providing an additional shipment of PPEs and other supplies that's enabling us to open up that second site. So tomorrow, just like today, testing will be available at both sites in the city of Houston, Butler, as well as Del Mar, and it's open to everyone who is experiencing symptoms. And so if you're having a dry cough or breathing problems, fever, regardless of your age, whether or not you're a first responder, healthcare provider, if you are experiencing symptoms, please go through and call 832-393-4220, and you can speak with a health nurse, be screened, and then be given the authorization code to proceed with the screening. I also want to acknowledge, and then in terms of the count in the city of Houston, and again, I always want to qualify these numbers because we recognize whatever number we give you, there are more cases that are out there that we have yet to identify because of the lack of testing. But as of today, 68 more people were tested positively, which brings the number in the city of Houston to 377. 377 as of today in the city of Houston. But again, we fully expect that number to continue to go up, and we know that there are more cases out there. But the more people we're able to test, that means that we can also trace and then isolate where possible to prevent the spreading of this disease. And I'm sad to report, City of Houston now has its fourth death as well, person in their 70s, and then Dr. Peirce at some point can speak to that person. With respect to the number of employees, for example, who have tested positively for COVID-19, as of today, we have 8 firefighters who have tested positively, 12 Houston police officers, and 18 City of Houston municipal workers, and that then will cover all 23 of our departments. I do want to thank some people in our city, businesses and others who have stepped up and really been supportive and provided supplies, and not just to the City of Houston, but I know to the county and others as well. So let me just give a thank you to Lowe's, to Home Depot, and also to the country of Qatar. All of these individuals have stepped up and provided N95 masks and other supplies for our employees and for others as well. So let me give a big thank you. And then in addition to that, like everyone, we're working on the private market to secure more N95, KN95 masks, surgical masks, gowns, and we made a purchase just on that just the other day. So we want to make sure that we're doing everything on our part to make sure that we have the necessary supplies for our first responders and all of the people who are working at the City of Houston. So, Judge, let me thank you. Look forward to continuing to work with everyone. And certainly let me remind people, we know that April 30th may seem a long way off, but the reality is that if we work together in concert, we can come out of this much quicker if we continue to be very focused. Thank you very much, Judge.
Dr. Boom, if you'll step up to the podium, thank you.
Thank you, Judge Hidalgo, and thank you, Mayor Turner. I'm here on behalf, along with Dr. Klopman, of all of the CEOs of the Texas Medical Center, and we want to thank each of you for this action. We stand fully behind you in supporting this action of extending the order till the end of the month. I also want to thank the first responders. I want to thank all the doctors, nurses, clinicians, really across the Texas Medical Center and all of our healthcare institutions. They truly are the heroes in this story. They're working hard, they're dedicated, and they're just doing a fantastic job. We're all proud of you and grateful to each of you. Let me give you a little bit of perspective on why the hospital CEOs are so united in saying that this is the right thing to do. When we look at modeling and we look at our own internal data, which shows significant increases in the number of patients we're caring for, those models really are tracking along with the New York City models. They're tracking along probably 11 plus days sooner than the New York City models, but they are tracking along with those models. And so the time is now, and the time has been over the last couple of weeks as we've had these sacrifices that everybody are making to help flatten the curve and to make sure that we deviate from that curve. And that really ultimately is the goal of doing all of this. We have some cause for, I think, some cautious optimism. Here we had orders starting in place when we had one person with community spread. In New York City, there was a significant outbreak already before that happened. We, of course, have potentially a temperature advantage in how the disease spreads from person to person. And, of course, we don't have the population density and many of the characteristics of New York City. And so we frankly cross our fingers and hope that those things will help us. But the most important thing is social distancing, physical distancing, et cetera, that we've all talked about here. And that's really where all of us together in the community come together and all take care of each other. And that's really what this is all about. I want to take a second and put my primary care physician hat on, which is to recognize how stressful, how horrible this is for many people and how difficult and anxiety-producing it is, I urge everybody, take care of yourselves. Eat well, sleep well, exercise well, use alcohol if you're going to use it judiciously. Watch out for each other. Recognize that social distancing does not mean social isolation to where you're not interacting with other people digitally. Reach out to the vulnerable, reach out to the people you love, spend time with each other virtually and digitally. And then I just want to end by, again, thanking the healthcare workers. You know, I've had many of them come up to me say, we've been preparing all our life to do this. And that just summarizes perfectly what the people are stepping up and doing. And I want to thank them again. They're here for you, for all of us across the city of Houston and Harris County and the surrounding counties. Please be there for them. Please help them. Please do your part so that we can all control this and hopefully get back to our lives as normal before too long. Thanks so much.
Thank you. Dr. Klotman from Baylor College of Medicine.
Great. Thank you very much. First, I want to thank the judge and the mayor for their leadership. This is a very difficult decision to make, but it's extremely important. Also want to emphasize that Texas Medical Center is completely unanimous in their belief that this is an important step. And there's one other little piece of data I think it's really important for everyone in Houston to understand. If we maintain a very strict social distancing the way we're doing now, and we can keep the infection rate as low as we are currently, we will probably not exceed our capacity to care for people. And in addition, we think the peak will end in about 4 weeks. If we don't, and we track along New York City's infection rate or Italy's infection rate, not only do we exceed our peak of being able to take care of people, but we push the peak out for about another 4 weeks. And so rather than being at home for 4 weeks, it's more like 8 weeks. And so this is something that every Houstonian needs to understand. We talk about social distancing, but it's up to every individual in our city to actually accomplish that so we as a collective can manage the caseload and take care of you as Houstonians. So we're really asking you all to understand why we're doing this and to really be participants. We collectively can actually help the whole system work. So I'm asking, reaching out on behalf of government and the Texas Medical Center, all the doctors and caregivers, staying home is something you can individually do to help manage this epidemic. So please think about that before you go outside. Thank you.
Thank you so much, Dr. Klotman, Dr. Boom, for your leadership. And I've spoken as well with Bill McKeon, the head of the Texas Medical Center, and it's just been wonderful to get their guidance, their models, and their support through all of this. We really are following their lead, their advice in making the decisions. I want to also address another point, and that is the Harris County Jail. We know that the Harris County Jail is a ticking time bomb. We already have a case in the jail. We're likely to see more in the coming days. Public health experts have made clear that it's a dangerous situation. We have 8,000 people in the jail. So the cramped conditions there make it virtually impossible to enforce social distancing, proper quarantining of sick people. And it goes beyond the folks who are inside the jail as inmates. There are about 3,000 staff and contractors who go in and out of the jail every day, law enforcement folks and other contractors. And every person, every one of those workers has a family that they're putting at risk when they go in and out of these cramped conditions. Most importantly, our bed capacity right now throughout the region is in the thousands, perhaps close to 4,000 beds that are available, total about 18,000, but they're taken up, right, by the strokes, the heart attacks, the pregnant women needing to give birth. And so the number of beds that we have truly available to take on COVID-19 cases is limited, and it's just a couple thousand, around 4,000. Now you think about the fact that there are 8,000 people in our county jail downtown. These folks are coming out, and whether they're coming out to go take up a hospital bed because they have COVID, because they need a respirator, would be a big issue for our community at large. As I mentioned, There's one confirmed case already among the inmate population, but there are 24 inmates already with symptoms. There are over 1,100 non-symptomatic inmates who are in observational quarantine because of their contacts with other folks. So already the situation is quite challenging, incredibly dangerous, and dangerous as per the healthcare experts. And I'll have Dr. Porsa with Harris Health speak to this in a minute, as Harris Health obviously is very closely involved with our jail. So I don't have to spell it out for you. A case in the jail, exposure in the jail will spread like wildfire if we don't take drastic measures. And so I've discussed this obviously with Sheriff Gonzalez, with the judges, with several chiefs of police. Our team has spoken with victims advocates. We've discussed with the mayor, with other colleagues, and I will be signing an order later today that says, with certain exceptions, as long as we're under a disaster declaration, we will not hold individuals in the county jail on nonviolent charges. As I said, there are exceptions. So in order to protect public safety, we will not release individuals who've been convicted of violent crimes that involve physical violence or the threat of physical violence. This is exclusively for non-violent. We will not be releasing folks on burglary of a homestead charges or DWI third charges. Now, this will amount to around 1,000 inmates, but that is an estimate. And the reason that is an estimate is because we're going through a process. Each of the folks that fall under this category of nonviolent, no violent crime antecedents will go before the sheriff, pretrial services, and a group of criminal justice stakeholders who will review each person to ensure they don't have a violent history. They will review each person to ensure we're not releasing anybody into homelessness, that we're connecting them with services. They will work on conditions where relevant, ankle monitors, breathalyzers, etc., ensuring that they'll come back to court and that they'll be tracked. Of course, the goal is to move through the process efficiently, so we hope that this will take a few days, perhaps 3 to 4, and we'll see as we begin going along. I want to make a couple of key points here. First is that those being released are not being absolved of their alleged nonviolent crimes. Of course, everybody has not been convicted. These are folks who've been accused of crimes, but if found guilty, once they face the judge, if found guilty, those who are committed, who have been found guilty of those nonviolent crimes will still face justice, will still face time if necessary. Second key point is that the order is consistent with the governor's executive order that says no violent criminals should be released. And that's the point of this, is we are not releasing anybody with violent histories or violent criminal histories. A note for victims. Crime victims deserve to know we're working on their behalf too. I want them to know that these folks are not getting a free pass, and to reiterate that if found guilty, those who've committed these nonviolent crimes will still face justice. We've been in touch with victims advocates. We will be putting the resources they've advised us to include into the order we'll be issuing. And we will continue to work to make sure we're evaluating each and every person that goes through this order. This is a discussion we've been having for a couple of weeks. As folks know, we've seen this issue coming. Alarms have been raised around the country. Alarms have been raised in the healthcare community. And so our felony judges have met already. They've been taking steps already, along with the sheriff and with the DA. So our numbers right now at the jail, that 8,000 number, is already lower than what we had, say, a couple of weeks ago. The problem is, though, that we're still at a population of almost 8,000 people. And imagine 8,000 or even a percentage of those sick with coronavirus, needing hospital beds, needing ventilators and ICU space. Today, the downward trend actually stopped. And so today we have more people in the jail than we did yesterday. I don't feel that we can wait any longer to outline exactly who needs to be out, that is the nonviolent folks along with the carve-outs I mentioned, and get moving in a coordinated way with a very clear path as to who will be released, and that's why I'm issuing the order today. I'll conclude by saying this is obviously an unprecedented situation. All of this is an unprecedented situation, and I can tell you that the steps we're taking today are the best way to keep the community safe. Whether it's the bar and restaurant order, the stay-at-home work safe order, this order I am issuing later today on the jail, we've been leading by staying ahead. We are going to act and not react. The moment we're reacting, we're behind. And our North Star continues to be science, continues to be what public health experts tell us. The bottom line is the jail population is at risk of being the epicenter of a catastrophe, a catastrophic outbreak in our county, threatening not just inmates, not just the 3,000 folks who work in the jail, but the entire community who needs the bed space that is in limited supply. And so the recommendations have been to reduce the population. We're obviously looking at moving some inmates. We're working on that at top speed, but we've got to reduce the population as much as possible. There is no room for politics when it comes to this decision, and it's the only choice we have. If Dr. Porsa will make some comments as to the jail, then I'll repeat my remarks in Spanish, and then we will take questions.
Thank you, Judge. Let me also start by saying thank you, Judge, Mayor, for your leadership, and also reiterate the fact that the TMC CEOs, including Dr. Klotman and Dr. Boom, who are in presence here, we fully support the decision that has been made about extending the social distancing for the entire month of April. As far as the Harris County Jail, jails, correctional facilities historically have been a situation in which infectious diseases have increased dramatically in the communities. This being tuberculosis in the 40s and 50s, being HIV/AIDS in the 70s and 80s, and then MRSA infection in the 80s and 90s, and now this pandemic. As Judge mentioned, 8,000 people in the Harris County Jail, as a point of reference, that's larger than 50% of the towns in the state of Texas. So we're talking about a city within a city when we're talking about Harris County Jail. All the directives that have been issued to this point about the social distancing, and to Mayor's point about flattening the curve, they are impossible to enforce or to follow inside the jail situation. The inmates inside the Harris County Jail cannot socially distance each other. They're using common bathroom areas, common tables where they eat, and where they sleep. This issue of the Harris County Jail is not protecting just the inmates or even the workers, both the custody staff and the healthcare staff who work outside the jail and commute inside and outside of the jail, but it's really protecting our community. It's about protecting Harris County and the city of Houston. When those inmates contract the COVID-19 disease or are infected or asymptomatic, and they come outside of the jail, or they come in contact with the custody or the healthcare staff, who then become infected and bring that infection outside of the jail, now we're talking about a widespread COVID-19 infection in our community. That's what this directive is trying to prevent. I want to congratulate and acknowledge the judge for recognizing and acknowledging this and addressing this issue. An outbreak of the coronavirus inside the Harris County Jail can be devastating to our community and to our healthcare facilities. I cannot emphasize that enough. Even a small percentage of the Harris County Jail inmates coming down with the infection and requiring hospitalization, that by itself can actually overwhelm our hospital systems in this community. So again, I want to thank the judge for recognizing this issue and addressing it. Thank you.
Thank you so much, Dr. Porsa. I'll repeat the remarks briefly in Spanish. En español estaba informando el día de hoy que ya más de 50,000 personas han tenido acceso a nuestra base de datos de información que logramos lanzar el día de ayer con detalles acerca de los casos, el número de casos. También las buenas noticias que hoy recibimos más materiales del gobierno federal para continuar nuestras sedes de prueba en el condado, en la ciudad. Entonces tenemos suficientes materiales para continuar las pruebas por al menos 2 o 3 días más hasta que llegue el siguiente envío. Eso es pues muy buenas noticias. Hasta ahora hemos podido ser un modelo no solo para otros condados, otras ciudades en el estado, sino también alrededor del país, gracias a los pasos proactivos que estamos tomando para actuar y no reaccionar. Y para poder lograr eso, necesitamos la ayuda de todos, como ya hemos discutido. Espero que en unos años podamos contarle la historia a nuestros hijos, a nuestros nietos, de cómo trabajamos juntos en la era del coronavirus, de los sacrificios, de los trabajos perdidos, de la dificultad de cuidar a los niños, de enseñar a los niños que no estaban en la escuela, de todos los sacrificios que tuvimos que hacer para poder sobrevivir esta crisis, pasar esta crisis de la mejor manera posible. Eso es lo que esperamos poder evitar lo peor de la crisis. Y el día de hoy continuamos en el punto de retos y de sacrificios. Todavía no podemos llegar al punto en el cual estamos recordando esto como algo que ya pasó. Para que esto pase más rápidamente, tenemos que prevenir el contagio. Y es por eso que hoy día voy a anunciar el extender la orden de quédese en casa, trabaje seguro. Hemos escuchado de los presidentes de los hospitales más grandes del condado. Todos ellos han estado analizando la información, ven en este momento que los casos están creciendo de una manera que muchas veces, de muchas maneras, se parece a lo que sucedió en Nueva York y en Italia. Nosotros estamos en un punto mucho más temprano de cuando ellos tomaron sus medidas, entonces queremos hacer todo lo posible para prevenir algo más difícil, más peligroso. Lo bueno de tomar medidas más drásticas o extender nuestras medidas en este momento es que siempre y cuando hagamos eso, el tiempo que vamos a tener que permanecer en casa va a ser menos. Explicaba ahorita el doctor, por ejemplo, que si no tomamos estas medidas, serán 2 meses o más los que tenemos que estar en casa. Si tomamos las medidas el día de hoy, extendemos por el resto de abril, esperemos que podamos levantar esto lo más pronto posible. Entonces, hoy voy a extender la orden hasta el 30 de abril, hasta la medianoche, el 30 de abril. Aplicará esto en todo el condado Harris, lo cual incluye todas las ciudades dentro del condado Harris, al igual que las áreas fuera de las ciudades. Si la situación mejorara antes del 30 de abril, pues haremos los ajustes. Pero la realidad es, siendo honestos, vemos las proyecciones y se ve que el punto máximo de casos llegará a eso del final de abril, si es que seguimos tomando estas medidas. Si no, vamos a ver ese punto máximo mucho después. Entonces, tenemos que todos continuar actuando, continuar poniendo de nuestra parte. Hemos podido evitar muchos más problemas por escucharle a los doctores, escuchar y respetar la información, las investigaciones que los académicos están haciendo, y esto es lo que guía la decisión del día de hoy. Tendremos la última orden, la cual simplemente cambiará la fecha en readyharris.org, y ahí también hay información acerca de las preguntas frecuentes que las personas han estado haciendo. Sé que el gobernador ha promulgado una orden por su cuenta el día de hoy y revisaremos si hay cualquier conflicto entre nuestra orden y la orden del gobernador, pues manejaremos eso. Pero yo apoyo la orden del gobernador y apoyo el que esté tomando pasos para proteger a todos los tejanos. Quería mencionar otro punto, y eso es acerca de la cárcel. La cárcel del condado es una situación increíblemente peligrosa. En todo el condado, a través de los hospitales, en esta región, vaya, fuera del condado Harris inclusive, combinando todas las camas de hospitales, tenemos por ahí unas 14,000. Ahora, todas, salvo unas 4,000, están ocupadas en este momento por ataques del corazón, mujeres embarazadas dando a luz, los temas médicos que se ven de día a día. Solo tenemos por ahí unas 4,000 camas disponibles para casos de coronavirus. A la vez, hay 8,000 presos en la cárcel del condado en este momento. Si se ven enfermos esos 8,000 presos, van a salir y van a salir a los hospitales, salir a esas camas de hospitales que todos necesitamos. En la cárcel también trabajan 3,000 trabajadores, policías, médicos, quienes regresan a su familia día tras día. Entonces, tomar medidas en cuanto a la cárcel ayudará no solamente a que los presos no se enfermen, sino también a las familias de estos empleados y la comunidad en general, la cual necesita estas camas de hospital y no puede permitir que haya un crecimiento exponencial de casos en la cárcel. Ya tenemos ahora un caso positivo en la cárcel, hay 2 docenas de presos que están siendo evaluados ya que tienen síntomas y hay más de 1,100 presos sin síntomas quienes están siendo observados porque han estado en contacto con aquellos que parece tienen el virus. Entonces ya estamos viendo contagio en la cárcel, puede que de hecho ya estemos muy tarde, es algo que hemos venido discutiendo y por eso, pues después de hablar con el alguacil, con los jueces, con ciertos jefes de policía, con personas que abogan por los derechos de las víctimas en el condado, hemos concluido que salvo ciertas excepciones, empezando el día de hoy y hasta donde exista la declaración de desastre, no vamos a tener personas en la cárcel bajo cargos no violentos, con ciertas excepciones. Como menciono, hay excepciones para asegurar la protección del público, la seguridad. No vamos a soltar a ningún individuo quien haya cometido un crimen de violencia física, tampoco situación de robo a una casa, ni menos conducir bajo la influencia a nivel por tercera vez. Entonces no se va a permitir el soltar ninguno de esos presos. Esto, cuando logremos analizar todas las personas que están acusadas de crímenes no violentos. Recordemos que las personas en la cárcel no se les ha encontrado culpables, simplemente se les ha acusado de un crimen. No vamos siquiera a considerar a aquellos que han sido acusados de crímenes violentos, pero aquellos de crímenes no violentos hay alrededor de 1,000 que vamos a poder soltar. Digo alrededor porque no hay un número exacto, ya que va a haber un proceso. Cada preso va a ser evaluado por el alguacil, por un grupo de expertos de sistema penal que trabajan para el condado, quienes estarán asegurándose que esa persona no tenga antecedentes violentos. Nos aseguraremos de no ir a soltar a ninguna persona que vaya a estar viviendo en la cárcel. Vamos a asegurarnos que puedan tener acceso a vivienda. Vamos a evaluarlos por síntomas del coronavirus para que no salgan pues a contagiar a la demás gente, y también vamos a implementar las condiciones necesarias, bien sean monitores adicionales, máquinas que les medirán su contenido de alcohol antes de poder utilizar el auto, todo ese tipo de medidas que se pueden tomar para asegurarnos que estemos observando a estas personas y que vayan a regresar a la cárcel o a la corte, pues, cuando sea necesario. Lo que quiero dejar muy claro es que aquellas personas que van a salir no se les está simplemente borrando el crimen del cual han sido acusados. Van a tener que ir frente a un juez, a un jurado, a enfrentar esos cargos de crímenes no violentos después de que pase esta crisis. Finalmente, el gobernador también ha puesto una orden el día de ayer o hace 2 días, promulgó una orden en cuanto a las cárceles y dijo que no podemos dejar salir ninguna persona acusada de un crimen violento. Y esto pues va con la orden del gobernador. Yo estoy 100% de acuerdo, no podemos soltar los criminales violentos, pero esta orden va a analizar y dejar salir a criminales no violentos o personas acusadas de crímenes no violentos. En cuanto a las víctimas deben saber que estamos trabajando también por ustedes. Como he dicho, no se les da un pase libre a estas personas. Igual van a enfrentar su caso, igual van a tener que ir y enfrentar la justicia. Es simplemente que en este momento no los podemos ni los debemos tener en la cárcel si son acusados de crímenes no violentos, y eso es por bienestar de toda la comunidad. Hemos estado en contacto con las personas que abogan por las víctimas y nos han dado muchos recursos. Esos recursos estarán disponibles también en la orden que vamos a promulgar más tarde para que todos tengamos acceso a esos recursos. Esta conversación ya lleva varios días, un par de semanas. He estado en contacto con los jueces, he estado en contacto con el alguacil, con la fiscal y otros. Ellos han estado trabajando ya por reducir la población de la cárcel, pero el reto es que seguimos a 8,000 personas. El día de hoy, inclusive, tenemos más personas en la cárcel que el día de ayer. Entonces, esta es una situación urgente de salud pública que no se está manejando hasta el punto que debe manejarse. No me parece prudente, no me parece responsable esperar ni un día más, es lo que nos dicen también los doctores, y por eso estaré promulgando esta orden el día de hoy para tener muy claro quién va a salir, aquellas personas bajo crímenes no violentos, y también hacerlo de una manera coordinada, de la manera más rápida posible. Esperamos unos 3 a 4 días, obviamente pasando por ese proceso. Esta es una situación nunca antes vista, no solamente esta orden, sino todo lo que estamos enfrentando con este virus. Pero la decisión que estoy tomando es el mejor camino para proteger la seguridad y la salud de la comunidad. Desde la orden de los bares y restaurantes, la orden de quédese en casa, hemos estado liderando, por ejemplo, mostrando con nuestro ejemplo que debemos tomar medidas proactivas en vez de estar reaccionando a situaciones difíciles. Nuestro norte, nuestra guía en esta decisión, como todas las otras, ha sido la ciencia, ha sido los médicos, y a nivel nacional se está diciendo que las cárceles son los epicentros de crisis si no manejamos ese tema. Aquí habló hace un momento el doctor Porza, quien es el director del sistema de salud del condado Harris. Él ha explicado, la cárcel es más grande que la mitad de las ciudades en este estado de Texas. Entonces tenemos una pequeña ciudad ahí donde no hay distanciamiento social, y como explicó él, en todos los contagios en la historia, siempre las cárceles han sido una fuente de gran crisis y gran problema. Entonces, este es la única opción que tenemos. Estamos obviamente evaluando opciones de transferir ciertos presos a otras cárceles. Eso se está haciendo lo más rápido posible, pero igual tenemos que hacer todo. Tenemos que reducir a esa población lo más posible. Entonces, con eso concluyo mis comentarios y ahorita vamos a responder a las preguntas. That's it for my comment. We're available to take questions, and Dr. Peirce, Dr. Shaw are here as well to respond to questions.
Great. Thank you, Judge. Can either judge and the mayor talk about the fact that the governor just issued a order of some kind? He did not call it stay home, but for all intents and purposes, it looks very similar to what Harris County issued, except for the part specifically about churches. I believe churches were exempted from his order, and that does it supersede the Harris County order, which said online church only?
We just got the news, as everyone else, about the governor's order, and so to the extent that there are conflicts, we'll work those out in the coming hours and days if necessary. Of course, supportive of his order, but I'm afraid I haven't read it personally directly, and I don't know how it tracks with our language. So we'll be addressing that as our lawyers sit down to analyze and work out with the state, where exactly there may be any conflicts. And as you know, our order was crafted and all our decisions based on the best advice, and all of our guiding light has been trying to minimize the potential for contact, for close contact, trying to minimize the opportunities for the virus to spread per healthcare experts' advice.
Mayor, I don't know if you had anything to add to that, but also a question from KRV specifically about what your thoughts about evictions. I know even though the Supreme Court and local JPs have said they would not evict, that there's still a lot of people getting letters, getting knocks on the door saying, hey, pay up, especially in communities of color and immigrant communities.
And that is very true. The question relates to evictions, and tomorrow being the first of the month, and people are very, very nervous. Just before coming here at the community pop-off session, we had a person that came and spoke to the members of City Council, a renter, concerned about his status, and also speaking on behalf of other renters, for example, across our region. It's my hope that people will honor and know the county judge has put in an order as it relates to evictions and saying no to evictions, even on the federal level in the bill, as it relates to all housing-related, federal-type housing that receive federal assistance, Fannie Mae, you name it, that they have said no to evictions. And the hope is that landlords and apartment owners will also work with people who are renting. The reality is that we're all in this together, and these are hard times. The renters didn't choose for this virus to be showing up at this point in time. So it's going to take all of us working together, and I'm hoping that the apartment owners and the tenants will be getting together. Councilmember, I want to give him credit. Councilmember Edward Pollack came up with an excellent idea. When people are paying their first and last month's rent, for the apartment owners, for example, to go ahead on and utilize that last month rent for this particular month, to at least give them another month. And then where there are any additional deposits that are having to be made, that they will also utilize that as well. So I know, for example, for the city, we're not turning off any any people's water. We're not disconnecting, and that's whether you're an apartment owner or a person who's renting. We're not doing that. And then we're hoping that the retail electric providers will also not be disconnecting people on their electricity bill, but would work out plans for them as well. And then lastly, let me just piggyback on respect to the faith-based community. You know, I know I've been talking with members, a large number of the faith-based community, almost every week for the last 2 to 3 weeks. And the judge and I are scheduled to be with them again on the line, for example, on Thursday. And I will say the overwhelming percentage in the faith-based community are now doing online streaming services. They are being very, doing their part to adhere to social distancing. And I will tell you, in order for us to blunt the progression of this virus, it's going to take all of us working together. There are some churches, for example, that have their members calling other members and asking, how can we be of help to you, on the phone or online. They're doing those type of things. We have members in many of these churches and that are making masks and providing other type of supplies, working, helping out the seniors. So the church and our, as it relates to the faith-based institutions, it's not just the walls. You know, the church goes beyond the walls. And quite frankly, it's a living organism that's not contained by the walls. So I believe that the faith-based community is being very supportive. I want to thank them for stepping up and for adhering to the principle of social distancing.
And let me, Maya, I'll just comment on the evictions question briefly, and I do want to echo the mayor's gratitude to the faith community. I have seen that as well. On the note, on the point of evictions, the justices of the peace in Harris County said they would not be pursuing eviction cases through the month of March. Then the state issued guidance not to pursue evictions through to process evictions at the judge level through April 16th. And I have said, and I will reiterate, that I'm ready to issue an order extending that even beyond mid-April were it to be necessary. And so right now, obviously, folks could still be evicted and that will be processed if it's something like domestic violence, something of that sort. But folks who cannot afford to pay rent because of coronavirus crisis, the judges will not be processing those cases. Rent will still be due at some point in the future. And we are all looking, we're grateful for the federal package. We're looking at the county, anything we can do to provide renters assistance. We're exploring everything we can do. And right now the best has been that leadership of the justices of the peace, the state, and also, as I said, I'm ready to extend if it were to become necessary.
From KHOU, there's some interest in talking about the supply of testing. I understand you guys just said you got a new supply. The county has 2 locations. And Mayor, you can address the Del Mar, the standing up the second location, and whether the county and the city, how long your current supply of PPEs and other things may last.
The county we received our supply this morning. So we still have to go through all the inventory, and that's why I can't give an exact number of days. But from our first blush, we think at least 2 to 3 days that we can maintain the testing. Now, this is a chance to remind folks, we want to keep testing. We are running at full capacity, over 4,000 tests since we opened last Monday, just in the 2 county sites. But again, folks have to remember that the test is not a treatment, it's not a cure. If anyone's feeling sick, even if you don't have a diagnosis, you should assume you have the virus and stay away from other people. Certainly, if you feel sick and you're as part of an essential business, you shouldn't be going to work. We'll continue to do as much testing as we can. It's not as much as we would like for the size of our region. We're limited by the access to supplies. And so the most important tool we have in our toolbox right now is social distancing. It's the only one we can count on. Whether or not supplies arrive, we know we have it for more than 2 to 3 days. We know it's effective. We know it has been effective already in not having such a rapid spread, but we're still seeing a very rapid spread. And so that's why, the main message from me, as much as we'll update the numbers of diagnosed cases, we'll update folks on the testing. We will do as many tests as we have supply for, and we will continue to scour the globe for more supplies. But the biggest thing we can do is to continue to stay home, to heed that order, to just accept that difficult situation, and remember that we're doing it for our community. Mayor?
Yes, tomorrow the City of Houston will be standing up its second site at Del Mar, and again, we're prepared to go to maximum capacity, which is 250 at that particular site, along with 250 tests at the Butler site. And the way we're going to operate, a lot will depend on the shipment that we get in from the federal government. We're going to assume once we stand them up that they will continue to provide the shipment in order for us to continue to test. One thing we do know, the more testing we do, the more we can trace and isolate and stay on top of this virus. Just in talking with the elected officials on the state and federal level this morning on the conference call, they would like to see even more testing. And especially more testing in very vulnerable communities. Because what we're seeing in New Orleans, the reason why they have such an outbreak is because you have a lot of people in New Orleans who are poor or who have underlying medical conditions like diabetes and hypertension. And in many cases, those are communities of color. And so it is imperative, for example, and would be helpful for us to be able to do even more testing in these particular communities and neighborhoods in our respective in the city. But we are limited. We are limited by the PPEs because in order to do the testing, you have to protect the healthcare workers and everybody out there who's on the front line. And so you can't just go and say we're going to do testing if we don't have all of the equipment, the gowns, the gloves, the goggles, the masks that are needed for that to occur. But we do know we need robust testing. That will help us to stay on top of it. But tomorrow in the city of Houston, we'll have 2 sites up and running, which will double our capacity from today.
Do they still have to pre-screen, like call ahead, or?
They still have to do the calling at 832-393-4220. I know the county has an online, go online, harris.org.
ReadyHarris.org.
ReadyHarris.org, and they can do that. And again, the testing now goes to anyone with symptoms, regardless of their age, whether or not they're a healthcare provider, first responder. If you have symptoms, dry cough, tightness of the chest area, fever, then you would be eligible.
Mayor, from KPRC, they would like to know about the old Bel Air Hospital. I guess the landlords there were not welcome for wanting the city to be considered for overflow at the city of 77 beds. Were you aware of that? It appears like, I guess they reported that the old Bel Air Hospital and the landlord didn't want to enter into a lease with a local medical group for 77 beds. Are you aware of that issue? And then also, what's the latest? Another media station would like to know more, KHOU would like to know more about Kendrick Hospital, the one you did visit. Can you address those 2 overflow locations?
Well, certainly we are out there looking at potential overflow sites in case it is needed by our hospitals for them to expand. We would work directly in collaboration. Dr. Purse on city side is the city health director, and we'll be working directly with our hospital system. Let's say we assume the worst. We assume the worst, but we want to be prepared for the worst. So we are looking at what additional sites may be available that can be set up instantly. I did tour the facility, the old Kindred Hospital in the Heights area on Sunday. In that particular space, there were 68 beds that were available. 21 of them were ICU, with capacity to even put more beds if needed, and it's ready to be stood up right now. But again, we're just kind of surveying to see what resources, what facilities are available in case they will be needed, and then working very closely, for example, with our hospitals to take it from there. But I do think it's important, even on the front end, even while our numbers are modest, to put together an inventory of all assets that are available that can be put into use at a moment's notice.
Is there somebody in the medical community that can talk to us about how many beds total there are in the TMC and how many?
Dr. Porsa, if you'd like to just briefly estimate and
how many are
yeah.
how many ICU beds? How many ventilators? Does anybody
and
have some statistics they're asking?
Yeah, and I will share, this is a constant topic of conversation for us, and of course it depends, which ones can you convert. What about when you use the hallways and you use the eating areas and you make that into beds? And so the estimates we have are rough. We're continuing to work with that and just saying, regardless of that, what are we going to build at the city, at the county? So for us, looking at NRG complex, for the city, what the mayor talked about. Dr. Porsa, anything to add on this topic?
Thank you, Judge. I don't have the exact numbers, and as you can imagine, the numbers change every day. What I can tell you is that the TMC hospitals, we meet every day, and we've been planning on a surge issue, and that involves anything from capitalizing on the existing assets, all the ICU beds, transforming some of the, for example, CCU, SICU to medical ICU beds, transforming some of the IMU beds, intermediate care unit beds, to ICU beds, and things of that nature. But in addition to that, also doubling, times tripling our capacities as far as putting more beds into existing hospitals.
Have you guys done any modeling as far as when you will hit that capacity? I thought you guys said that you will hit May 2nd is the main date. You're wondering if the curve might come down?
So it
Explain
depends
that to us
on
a
what the
little.
infection rate is. So if we maintain our very aggressive distancing, social distancing, and we can keep the infection rate around 2 to 3%, which would be very, very good. The models and even the actual data that we've been following looks like we will be able to manage the capacity that we have with all the things we've talked about, internally generating capacity. If we don't do that and we look more like New York or Italy, we will exceed our capacity in about 3 weeks. And then we really are going to be in a position of scrambling for new facilities, field hospitals. That's why it's so important that we try to maintain our social distancing now. But it's very much dependent upon if we can control the infection rate. You have any?
Yeah. And I think that the doctor was saying that the curve peak projection, best case scenario is maybe May 2nd. So are you prepared to extend the order past April 30th?
Look, we're taking this based on the data. Right now, what we know for a fact is we are not in any position to end the order today because our peak would, at the earliest come later in April, toward the end of April. We'll continue to watch the data as all doctors, I think, have mentioned so far. To the extent that we're able to pursue these social distancing practices, our infection rate will be lower. This will peak sooner, and it will peak at a lower curve. It won't require as much of our hospital capacity. And so the most we can do and the best we can do right now is continue with social distancing, continue to trace the data. If we don't follow the order, if we decide to go and spend time in groups and be in close contact with other people and thereby increase the rate of contagion even more, Yes, and they mentioned it. Then we would see this continue for much longer. If it was going to take a month, it'll take 2 months, and so on. And that's why whether you look at it because you want this to be over with as soon as possible, or whether you look at it because we want to make sure our hospital system, our healthcare system, and thereby our community is not overwhelmed by this, we need to take these social distancing steps. We need to stay home and heed the order. I will say as well, right now, the projections that we have get better by the day, and we'll continue to share that information with the public. But the tool is ultimately in our hands, and that is being able to stay home and making sure that we don't get to the worst case scenario that other communities have seen.
Is there a plan for the homeless community? That was a question from KPRC as well.
Yes, so the question is if there's a plan for the homeless community. Yes, we're in close communication, and Mayor, I don't know if you have something to add on this, but I'll tell you, we've been working at the county. Our commissioners have taken a lead on this, and they've been working closely with the city, with the nonprofits already to ensure that we have space for folks who don't have a home. I believe we've got some hotel space. We're also looking at that in some of our NRG plan. I mean, it is absolutely something we're discussing, and in fact, I was just exchanging messages this morning with the county executive in King County about how they're dealing with the homeless population in Seattle and what we can do to learn from them.
And I am pleased to say that the city and county are coordinating our efforts as it relates to the homeless, providing leasing even hotel space for them, the county agreeing to provide, for example, the ancillary services, food, and other things that would be needed. So we are both coordinating our effort on how to address the homeless population. In addition to that, we're also working with our faith-based community. Many of our churches, for example, most of them are online. So even in a conversation with Pastor Rudy Erasmus, who's offered, for example, his facility as additional space in order to thin out the homeless population in our shelters, because there's not much room in our shelters for them to engage in social distancing. And so the plan is to thin out that population so that they can even engage in social distancing there, and then working with our faith-based community that will be able to house some of the homeless community. With respect to those on the street, we want to be able to provide personal protection equipment, certain things for the volunteers who are out there attending to the needs of those on the street. We're providing sanitizers to our homeless population and also to those volunteers. And one of our greatest challenges now is that even many of the food kitchens, you could say, some of them have closed for the moment because of their concerns, and so we want to provide them with the necessary items that they need to enhance their protection so that we can continue to serve and meet the needs of those on the homeless
When do you
population.
think some of that will happen?
That's the ordinance, for example, for leasing the hotels, that's on City Council tomorrow. I believe the county has already voted on their portion. And so this is a very collaborative effort between the city and the county, and I want to thank the judge and the county commissioners for working very closely with us.
And Mayor, just one more thing from you is earlier this morning during the Finance Committee meeting, the controller laid out sort of what we all know, which is, the tax between the oil and coronavirus, sales tax and everything, just taking a nosedive. What are you looking at? Painful cuts to either city services or staff, and if not now, do you anticipate doing that soon?
Well, financially, we all know we are going to the revenue coming into, for example, to the city is going to be down. I mean, that's a given. We work on the budget year round, and we anticipate even the worst scenarios. This one is even worse than anyone had imagined. And that's why it's so important for us to be very aggressive at blunting the progression of this virus so that we can get back to a normal way of living as quickly as possible, get our businesses up and running as quickly as possible. And that's why I would say to you, I know it is painful for a lot of people who are hearing that the order has been extended till April the 30th. I know it's painful. But what I would also say, that if we don't work together in a very meaningful way to slow the progression of this virus, then the period of time in which we're going to be dealing with this will be far longer. So for the city, in terms of its revenues and how we'll balance the budget, it's going to be tough. There's no question about that. But, I guess an analogy I would use, my mom reared 9 kids as a maid on very little. You just find a way to make it work. And in this city, we just find a way to make it work. The same thing applies for the county. We're going to find a way to make it work. And we'll get there if we work together and recognize that it's shared sacrifice on the part of everyone and not just on the part of a few. Everyone has a role to play in this game. And our role is to engage in social distancing and to do everything we can on our part to blunt it. Hospitals are going to do their part to take care of people who come into their systems. And then if we work together, shared sacrifice will come out of this much sooner.
Well, I think the Chronicle wanted to know from Dr. Shaw and maybe Dr. Peirce if they've seen anything since we've stayed at home for a week and a half, if they've seen any data that might correlate to it being better for us, anything like that.
Dr.
Have you guys
Shaw,
looked at
and
it?
I imagine, Dr. Boom, I know you guys have been discussing. So
Have you
maybe
guys
we
done
can
any
invite
modeling?
them.
Have you seen any positive benefits for at least some people trying to stay home?
Yeah, thank you for that question. So Dr. Umair Shah, the Executive Director of Harris County Public Health and the Health Authority for Harris County, and Dr. Peirce and I constantly having these kinds of conversations and discussions along with our healthcare community. I also want to thank everybody for the incredible support that we've had from our healthcare partners and TMC in particular with our institutions. And what I really want to say is that, we've talked about the fact that as we make decisions that you start to actually see some change a few weeks later. You don't see it right away. So unfortunately, that takes time. There are a lot of factors that go into this mix. We've had constraints on testing, not had as much testing that's been available. Obviously, testing has now increased, which also then further complicates the numbers because you start to see an increase in numbers. You don't know if it's because it's increase in testing or because it's an additional nod towards increased transmission, community transmission that's happening throughout our community or our region. And so it's hard to know right now. I think the key thing that we're trying to tell people is, look, we're doing everything we can. We're watching all of the different metrics that we have. We're working with our healthcare partners. We're looking at cases. We're obviously concerned about individuals who are being diagnosed. We're also concerned about individuals who are getting sick or in more critical condition in the hospital. And we have to just continue to emphasize that we want to be emotionally together while physically apart. And I think that is really a key message for us. Right now it's too early to tell, but we are working with our partners to make sure that we continue to stay on top of this. And Dr. Peirce, you may have some additional comments.
Thank you, Dr. Shaw. So what I would say with that question is, number one, as Dr. Shaw pointed out, it's too early. Traditionally in public health, when you do a community intervention during an epidemic, it takes about 2 weeks before you see the impact of that. And so we're at the point now. But what I would focus on is not what we're seeing, it's what we're not seeing. So the numbers do continue to rise. We do believe, as the mayor pointed out, that there is spread going on within the community. But what you're not seeing is you're not seeing the numbers skyrocketing like happened in New York. And what you're not hearing from our friends in the hospitals is that they are already busting at the seams. So one of the things that the mayor had said early on is that when this is all over, if we're criticized that we got too aggressive and it didn't turn out to be so bad, that is exactly the situation we hope to be in. So I wouldn't focus on what we're seeing, is what we are not yet seeing. And if we all continue to do our job, as has been mentioned up here, then as Dr. Klopman pointed out, then our healthcare system, if we all continue, do not stop. This is not the time to stop, just because we're not seeing the skyrocketing. If we all continue, we should be able to remain within the means of our current healthcare system. Thank you.
And I do want to add a note, because that's the question I ask myself every day, right? As we assess what data we have coming in. And so, we see our testing rate. We even saw, for example, the maps that were being put together in terms of how much people are commuting and what does that mean. And I think in many ways, the best information we have comes from our hospitals and our hospital leaders, because they're going to see people being sick. If someone is sick and needs the hospital, they're going to go to the hospital, regardless of if they've been tested positive or not. And so that's why it's so important to have these CEOs here and the group of CEOs sharing their analysis and what they're seeing, which is they continue to see a too rapid growth rate for us to say, okay, we're fine. Now, that means we may see a lag in terms of the positive results of the social distancing. It may also be that if we hadn't done that, the rate would have been increasing even more than we're seeing it right now. And so I do want to make a point. That's really why we include these CEOs here, is because as the best data we have really comes from them. And so I want to give a chance. I don't know if either of our Dr. Boom or Dr. Klotman have anything to add on this. I know y'all have been studying this in your hospitals.
The judge said it exactly right, which is that this, if it gets out of hand very, very quickly. We're encouraged by what we're seeing right now, but it's still too early, as my colleagues have said, to really understand the 2-week lag time to start seeing the impact. I am absolutely certain, however, that had we not done the things we've done and made the sacrifices we have as a community, we'd be seeing far higher numbers today already. There's no doubt in my mind. We just have to look really anywhere around the planet as we see these curves. So we're doing the right things. Please work with all of us, and we can keep these numbers down and hopefully emerge from this before too long, although as you've heard, it's probably going to be a good solid month or longer. Thank you.
And Judge, I know you guys got to go, but I know Televisia wanted you to talk to the immigrant communities about sort of what you already talked about, specifically people getting evicted or getting threats from their landlords, if you could answer in Spanish.
Sí, una pregunta en español acerca de los desalojos y la comunidad inmigrante. Hace unas semanas los jueces de paz decidieron que no iban a escuchar ningún caso de desalojos. Entonces, aunque reciba una carta, esa orden no va a ir frente de un juez, al menos ellos dijeron hasta el 30 de marzo. Después los jueces estatales dijeron que hasta el 16 de abril. Y yo les digo y he dicho que estoy preparada a extender eso si los jueces no lo extienden. Entonces, por el tiempo que sea necesario, por mientras continúe esta crisis, no van a estar procesando los jueces las órdenes de desalojo y si hay desalojo por causa de violencia doméstica, eso sí habrá que procesarlo. Pero si es que no puede pagar por esto del coronavirus, entonces no se preocupe. Ahora, cuando ya pase esta crisis, sí va a tener que pagar la renta en ese momento. Y por eso se le agradece al gobierno federal que está enviando ayuda. Estamos trabajando nosotros en el condado a ver qué ayuda podemos ofrecerle a aquellas personas que rentan y seguiremos explorando opciones. Pero por ahora, si paga impuestos de propiedad, esos no van a estar necesitar ser pagados sino hasta junio. Y si usted renta, no va a haber proceso de desalojos hasta que continúe esta crisis, siempre y cuando continúe la crisis. Y recordatorio para todos que pueden ir a readyharris.org. Ni las sedes de pruebas de la ciudad ni las sedes del condado le están preguntando si son ciudadanos o no, ni siquiera se hace esa pregunta. Entonces pueden hacerse las pruebas tanto en la ciudad como en el condado, y por ahora, como han dicho los doctores, se trata de quedarnos en casa, aunque sea difícil, es lo necesario para que no veamos que esto continúe por aún más tiempo y ni que haya una crisis al sistema de hospitales. Thank you. Yeah.
Do you mind in repeating that for the deaf interpreters?
Sure.
Thank
Yeah.
just for the hearing.
Sure. So I'm repeating for the hearing impaired. The question was about evictions. And so in terms of evictions, the justices of the peace said no evictions will be processed until March 30th. Then the state judiciary advised it had to go until April 16th. And I've said, and I'll say again, if they don't extend it further, I'm ready to issue an order ensuring that evictions are not processed or not filed past until and as long as this crisis lasts. So if you're being evicted because of domestic violence, something related to violence, that will be processed. But if it's because you can't afford to pay because of the coronavirus crisis, not to worry. Now, rent will still be due. Once the crisis is over, it will still be due. We're grateful for the federal support. At the county, we're reviewing what kind of rental assistance we can offer. And our tax assessor collector has also made the decision that property taxes, delinquent property taxes, will not be due until June. And those also will be due eventually, but not until June. So we're all doing everything we can to try and mitigate the impacts, and I want to make sure that the situation on evictions is clear. Thank you so much. Thank you. No, thank you.
Thank you, Mayor. Give you the envelope. Thank you. Thanks, Mark. Thank you.